So our treatment for these patients, when we ascertain that they have this condition, is a number of treatments that I would consider more curative than just palliative. So curative, meaning it does actually help the nerves to heal and repair. It allows for their quality of life to improve. I am not going to talk to a patient about curing them of all that ails them, because that would be inaccurate and it's not appropriate, because it isn't curable, but it is very much improvable if in fact the level of damage isn't too far to be helped. There are limitations where if some patients come and they are too degraded and their nerves are too damaged through either examination or through diagnostic testing that we would perform or send them for, then I would have to just have that conversation about us not really being able to take them on. That is thankfully the exception and not the rule. Most patients have amazing results because we take on the patients that fit the criteria that we can help. And of course, we're frank and open about the ones that we can't help. And they unfortunately are going to be subject to just taking prescriptions that will simply help manage their symptoms, but won't do anything to help the nerves to heal and repair. And I smile when I say it, and I'm serious when I convey it to a patient, but I tell them that I can't keep you on this earth any longer, but I believe that we can make your stay here a lot more comfortable. And I think they appreciate that. And if I can't do that, then we just don't take them on as a patient. And they might be disappointed, but they do understand that there are limitations, and they may have come to us too late in the cycle of those nerves actually withering, and they're living tissue and they're not getting blood flow or oxygen and nutrients. And if you stop feeding something that's living, it's not going to stay alive forever. And so we confront each patient with the assumption we can help them until something dictates that we can't. And then unfortunately, we do refer them out just to manage their symptoms, but realizing that there isn't much else out there that's going to really help the nerves to heal and repair. Patients who are under care are immediately realize that it is different, that they are not receiving anything that they have encountered at either a chiropractor or an acupuncturist or a physical therapist or an orthopedic or even a neurospine surgeon or a neurologist. So they quickly realize that this is different, but it's explained to them that it is different. Generally speaking, patients will feel some change within the first few weeks of treatment. However, nerves can heal over the course of several months. So patients are usually in the office a time or two a week for 12 visits, 14 visits, sometimes 18 visits, sometimes less than that, depending on their level of damage, which we completely individually ascertain so that we tailor a treatment protocol for them. But I would say far before halfway through their treatment, or maybe even a third through their treatment, they are starting to report, this is different. I feel and function differently. Sometimes it's a reduction in pain. Sometimes it's an increased feeling or sensation. Sometimes it's better quality and quantity of sleep. But we are constantly asking for those clues to an increased quality of life so that we can kind of compare and contrast that as to how quickly it's happening, where if it's not happening quickly enough, maybe we need to see them more often, or maybe we need to see them for a longer period of time. But again, I am a quality of life physician. I am not here to simply mask or cover symptoms. And if I can't improve your quality of life, you collectively as patients, then I would just rather not take someone on. And I hope that over the last almost 26 years in practice, this December will be 26 years in practice, I hope patients and physicians that refer patients to us, I hope they come to realize that my level of empathy and compassion and willingness to do whatever it takes to get them improved quality of life, we are going to take on, unless it's just not likely to happen. And although disappointed, they respect that.